Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about don't just age, engage. Your action plan for a sharper mind. Normal age-related memory changes. Age-related memory loss is selective. Not all memory types decline equally. What does decline? Acquisition of new information. It takes longer to absorb new information, leading to difficulties with retention and later recall. Consolidation and retrieval. New memories may be harder to consolidate, transfer to long-term storage, and harder to retrieve. Attention and executive function. Decline in the ability to divide attention among multiple tasks, focus fully, and avoid distraction. What persists? Procedural memory, the ability to remember processes and skills, like riding a bicycle, using a tool, or playing an instrument, generally does not fade with age and holds up well, even in cases of Alzheimer's disease. The big picture. These changes are often relatively minor and may present a slower processing speed, not an impaired ability to function effectively. The brain's role, structural and chemical changes. Age-related changes in the brain structure and neurochemistry contribute to difficulties with new learning and recall. Key affected regions, hippocampus. This region is vital for laying down new memories and undergoes age-related changes. Frontal lobes, involved in attention, executive function, and working memory. Functions that decline with age. Mechanisms of decline. Structural and neurochemical changes in these regions can undermine the acquisition, consolidation, and retrieval of information, meaning you may struggle to recall something because you didn't fully learn it in the first place. Sleep's crucial role. A good night's sleep is essential for consolidating memories and transferring them to long-term storage. Research suggests the brain clears toxic proteins like beta amyloid associated with Alzheimer's disease during sleep. Lifestyle strategies, mental and social fitness. A proactive approach involving lifelong engagement and social connection is one of the most effective ways to support brain health. Never stop learning. Engage in mentally challenging activities throughout life, such as doing crosswords, learning a language, or playing an instrument to keep the brain in shape. Social engagement. Research shows that older adults who are socially engaged, that is, regular contact with friends, family, volunteering, have better memory and are at lower risk for dementia than those who are isolated. Address hearing loss. Hearing problems make it difficult to process and learn information. Adults with mild to moderate hearing loss remember fewer items from spoken lists. Addressing hearing issues can immediately help improve learning and memory. Physical health and diet. Physical and nutritional fitness are directly linked to mental function and brain volume. Aerobic exercise. People who engage in regular aerobic exercise tend to have better mental function and experience less memory decline over time. Exercise appears to slow the normal age-related shrinkage of the brain and helps maintain greater brain volume. Healthy weight and smoking. Maintaining a healthy weight, especially during middle age, and quitting smoking can reduce the risk of dementia. Quitting smoking by midlife reduces dementia risk to that of never smokers. Omega-3s. The omega-3 fatty acid DHA found in fatty fish is linked to lower rates of dementia. The best diets for brain health. Three healthy eating patterns are strongly linked to lower risks of memory problems. The Mediterranean diet, good for heart health. DASH diet, formulated to control high blood pressure. Mind diet, a hybrid of the two, specifically created for neurodegenerative delay. 10 brain healthy foods, green leafy vegetables, other vegetables, nuts, berries, beans, whole grains, fish, poultry, olive oil, and wine in moderation. However, recently it has been shown there is no safe limit to alcohol use. 5 food groups to limit: red meat, butter, margarine, cheese, pastry, sweets, and fried fast food. Vitamins, supplements, and stress management. While lifestyle is key, specific nutrient deficiencies and chronic stress can impair memory. Crucial vitamins. Vitamin B12 deficiency can cause disorientation and confusion, particularly for vegans and vegetarians who must supplement. Vitamin D deficiency. Low levels can impair mental function. Many people need a supplement due to low dietary intake and sun protection measures. Supplements. There is a paucity of strong scientific evidence to recommend supplements like ginkgo biloba, ginseng, or apoaquarin, Prevagen for overall brain health. More research is needed. Stress. Chronically high levels of the stress hormone cortisol can harm brain structures vital to memory, including the hippocampus. Mindfulness. Meditation programs may improve cognitive abilities, attention, some memory aspects, and reduce stress, thereby supporting memory. Medical and medication-related impairment. Treatable medical issues and medication side effects can mimic or worsen memory loss. Managed health conditions. Conditions connected to heart disease, hypertension, high cholesterol, type 2 diabetes are also linked to memory problems and increase the risk of dementia and stroke. Managing these is critical. Medication side effects. Many prescription and over-the-counter drugs can scramble thinking or dim memory. Risk. Older adults are more sensitive to these effects, and the cumulative effect of multiple drugs can impair function. Action. Review all medications and supplements with a doctor if confusion or thinking problems are noticed. Depression. Severe untreated depression interferes with concentration and processing information, causing forgetfulness. Treating the depression often restores memory function. Late life depression can sometimes be an early symptom of dementia. Recognizing and diagnosing dementia. It is vital to distinguish normal age-related changes from signs of dementia and seek professional help. Dementia versus normal aging. Getting lost. May pause to remember the route to the store. Gets completely lost on the way to a familiar place. Concerns. The individual is typically concerned about memory loss. Friends and family are more concerned than the individual, who may not recognize the problem. Personality. Noticeable changes in personality or inappropriate behaviors. Diagnostic evaluation. If dementia is suspected, a specialist may perform cognitive tests, memory, attention, language, and executive function. Brain imaging, MRI or CT scan. Spinal tap for Alzheimer's. Checks for abnormal levels of beta amyloid and tau proteins in cerebrospinal fluid. FDA-approved medications offer modest, temporary improvements but are not cures. Early diagnosis allows for timely intervention and management. Well, thank you for listening. Please consider buying my book, 100 Pathways to longevity and subscribing to this channel. Thank you.